course, Mark McLane, the minister, Mark McLane, we need you here too. And healthcare is one of the most important issues, of course, and of course gains a lot of attention. That's why we're working with the province to reduce backlogs and improve access to prescription medicine. The federal government is making historic investments of close to $200 billion over 10 years in healthcare for Canadians. This includes $25 billion over 10 years in new bilateral funding for the provinces and territories that focus on 4 shared health priorities: family health services, health workforce and backlogs, mental health and substance abuse services, and modernizing the health system. Back in December, we announced a 3-year bilateral agreement with the government of Prince Edward Island worth more than $94 million to improve healthcare access across Prince Edward Island. This includes ensuring all islanders have access to family health system by 2026. Today, we're here to announce another agreement that will support the health and well-being of islanders as they age. With this agreement, the federal government is investing nearly $30 million over the next 5 years. This will help folks age closer to home with access to home care and safe long-term facilities. Because after a long time of hard work, we need to make sure that our seniors enjoy a healthy and a dignified retirement. To be a bit more specific, the new agreement will support access to primary care and palliative care at home, expand the number of beds available in rural long-term care homes, and make sure quality and safety measures are aligned across our long-term care sector. Vitally important. The funding will also allow the province to hire additional health providers, including occupational therapists, to provide service in long care term homes. The new investment we announced today will make a real difference for seniors in our province as well as the loved ones. All islanders should have access to high quality health care when and where they need it. So thank you very much. And now I'm pleased to introduce Minister McLane.
Thank you, Minister MacAulay, and welcome everyone here today. It's a pleasure to join everyone here, and thank you to everyone at Riverview Manor for letting us use this beautiful facility to make this announcement today. So caring and supporting for our island seniors is a top priority. It is crucial that we enhance access to home care, community care, and long-term care for our seniors. And today's announcement does just that. I want to thank Minister MacAulay, Minister Holland, and the federal government for collaborating with PEI on the Aging with Dignity Agreement. Through this investment, an additional $29 million will be invested in caring for our island seniors over the next 5 years. A few of the exciting components involved in this new funding include a new hospital at home service offering acute care services at home by LPNs, RNs, and paramedics, increasing the number of palliative home care coordinators, expanding the Inter-I system used to access individuals' health needs in long-term care. Another exciting development is the mobile X-ray units, which we will deploy across the long-term sector. Those units have been ordered, and we're looking forward to providing that care at LTC facilities rather than transporting them to hospital. Also, we're going to hire additional allied health professionals to provide services in private long-term care homes to improve the wellness and quality of life for residents. We're also establishing a funding program for private long-term care operators to increase long-term care bed capacity and enable the provision of more long-term care services to residents in more places. We're always looking at new, innovative ways to improve our healthcare system and increase access to the support and services that currently exist. Collaboration between the provincial and federal government is key when it comes to enhancing these healthcare services. And I'd like to thank again Minister Holland and Minister MacAulay and the entire federal government. We're very proud of our relationship with our federal partners, and this is just another example. So when we work together, we can achieve great things. And today is another example of that collaboration. So thank you very much.
Thank you, Minister MacAulay and Minister McLane. This concludes the speaking portion of the event, and I would now like to invite Anne Genier, Media Relations Advisor with Health Canada, to handle the question and answer portion. Thank you.
We're just going to start with, I'll invite Ministers McLane and McAulay to go at the table for some signature. J'invite maintenant les ministres McAulay et McLane à venir s'installer à la table pour la portion de la signature. Thank you, ministers. We'll now take questions from the media on Zoom. Nous allons maintenant prendre les questions des médias sur Zoom. Alors, je passe la parole à mon collègue Mark Johnson. Over to you, Mark.
Thank you, Anne. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Just give it a few moments. Okay, il n'y a aucune question des journalistes sur le Zoom. There's no media questions on Zoom, so that'll conclude today's news conference. Thanks, everyone. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thanks, everyone, and have a nice day.